We are all forming cancers in our body all the time. You've got cancer. I've got cancer. What is going on? Why are we seeing common and also uncommon cancers being diagnosed at earlier ages? We almost view aging inevitably as synonymous with synchronous decline. And I don't think that's what the research is showing us. I've seen people go from stage 3, stage 4 cancer and wind the clock back and set themselves back to 0 stage cancer. Something I would have thought I would never see in my career is where the end of cancer is coming from. It's here. When you go home, you can eat foods that can help to boost your immune system, including people who are on immunotherapy. If they have the bacteria in their gut, they're likely to respond positively to immunotherapy, their own immune system, wipe out the cancer. You're missing that bacteria. You might not respond. That's not an option. That becomes now a life or death kind of state. It is now possible in clinical trial only, but it's now possible to take a cancer that you might have been diagnosed with, someone may have been diagnosed with, remove its standard, send it to a lab along with a tube of normal blood with normal blood cells, send that to the lab, use technology to sequence the human genome of the cancer. That's 20 to 30,000 genes of the cancer and sequence the genes of the normal cells. Same person, double the sequencing. Okay, 20,000 times, 20,000 as even a very smart person could not actually figure out, do the comparisons too much, too many numbers. So you get machine learning AI to help go back and forth, compare the cancer mutations with the normal mutations. All right, and subtract out those mutations that are also found in normal cells. You'll be left with the mutations only in the cancer. This could be done in a few weeks. All right. And now you've got the smoking guns of only the cancer mutations. Wow. And by sequencing the cancer, now there's no secrets that cancer is hiding. You lifted up the stone. There's no secrets underneath it anymore. You got everything. Now you can you ever seen Minority Report with Tom Cruise? All right. You know that scene where they actually have the glass panel and they can put on gloves and move things around on the glass screen. That was one of the scenes in the movie. I thought I always remember that's really cool. Well, you can metaphorically do that with the mutations on the tumor. Pick 20, 25 random mutations, move them up in the screen, connect them. All right, so I think about it as creating a pearl necklace. Each pearl being a mutation. All right, pick from a different part of the tumor. Connect the pearls together like the string of a pearl necklace. You cinch it together. And now again, this is metaphorically. It's a lot more complicated than that. You hit print, and now you actually print out the protein of the mutations. That protein you can inject under your skin, and now you are vaccinating yourself against your own cancer. Wow. How personal. How doesn't get more personal than that? Doesn't get more sophisticated than that. That is the kind of direction that the future of cancer therapy is coming from with immuno-oncology. It is not a replacement for anything else, but it is the kind of research that I'm involved with that is jaw-dropping, and that is so promising. I encourage people, by the way, if you want to see. So the question is, does this work? All right. And I'm not here to talk about anecdotes. I'm talking about things that change my mind when I see somebody who was in stage 4 brain cancer, who actually has now got no disease with this treatment, saying, what is going on? Why are we seeing common and also uncommon cancers starting at being diagnosed at earlier ages? Cancer is a disease that we all have always feared. Even doctors fear cancer, and doctors get cancer just like everyone else. All right, only we see the devastation, we see the sadness, the terrible effects and side effects that are associated with treatment and the progression of the disease itself. And we've all been touched by cancer. I've had cancer in my family, my mother, my uncles. I mean, you don't have to look very far to find somebody who has been touched by this dreaded illness. But I want to actually give a different perspective that most people won't know, which is that we are all forming cancers in our body all the time. You've got cancer, I've got cancer, and we all been having cancers from the time we were little. Okay, let me explain that to you. Our body is made of 40 trillion cells. Each of the cells have to divide and copy themselves. And that's why we are still here today compared to yesterday. And that's why we're still going to be here tomorrow compared to today. Copy, paste, copy, paste, copy, paste. That's how we actually make our way through life, by having our cells, 40 trillion healthy cells, copying themselves. Now, copying our cells through our DNA is you have to copy the DNA too. The genetic instructions is a pretty big job. And if you don't copy perfectly, the cells don't copy perfectly, you wind up having a mutation. And cancers form from mutations. I'm going to come back to why I'm saying that we all have cancer, just you and I sitting right here, right now. And this is how it works. If you actually think about 40 trillion cells copying themselves perfectly, I can tell you it doesn't happen. Our body makes mistakes every single day. Each of those mistakes is a mutation. And each of those mutations set up to be a potential microscopic cancer. Can't see it, don't know about it, like a pimple on your back. You know, somebody might point it out to you, but it'll never hurt you. And most of them will go away by themselves. For cancer, it's your immune system cruising by wiping them out. Okay? What are one of our most powerful health defenses? But let me tell you this, and how easy it is to make a mistake copying and pasting. If I gave you a sentence, Mary had a little lamb, all right, and I asked you to type it on a word processor, on a Word document, all right, 10 times, you'll get it perfectly. Julian, if I asked you to do it 100 times, you're going to make some mistakes. Fortunately, there's something called spell check that will let you fix it, all right? And that's what our body has, a spell checker that will actually fix DNA mutations, all right? So a few mutations, few mistakes in copying DNA, not a problem. So we can actually neutralize the ability for our cells turning into cancer at some point. But if I asked you to copy Mary had a little limb 40 trillion times, I guarantee you even a spell checker won't be able to keep up with it. All right? And each of those mutations that aren't fixed winds up becoming a microscopic cancer. So we form these little Ditzel cancers, harmless cancers in our body all the time. And fortunately, most of them will never become a disease. All right? This is from childhood onwards. No. It won't become a disease. Won't become a problem. Because our health defenses, our body's immune system, actually wings by like cops on a beat. Policemen driving through a quiet suburban area. They see a little microscopic cancer shouldn't be there, throw them in the back of the truck, drive them off, and get rid of them. That's really how our body takes care of cancer normally. And the reason I'm bringing this up in the context of your question about these earlier onset cancers is that we don't know. Is it that our defenses are going down, our immune system's weakening, our gut microbiome, our gut health is changing, and thereby our inflammation levels are rising? So these little tiny details that would normally not become a problem start to become a problem and at an earlier age. We don't know that. But it's a really good question to ask. What's going on that our shields seem to be going down and our cancers are going up? Now, is it also possible that we're being exposed more and more to harmful toxic substances in our environment? Like microplastics is a big topic that we are just beginning to recognize the magnitude of the problem. Besides not buying food packed in a plastic bag, okay, or microwaving food in a plastic container, which, you know, I don't recommend anybody doing because of the shedding of the microplastics. Do you know where most of the microplastics that get into our body come from? These inflammatory little particles that actually is studying our blood vessels. We know it's in our brain. It gets into every organ from your testicles to your penis, to your lungs, to your brain, cars driving on the road. Yeah, shed these aerosolized microplastic particles and we inhale them. Yeah, and they get into our body and it stands to reason that they're probably causing a problem. If you find a cancer early, you stand a much better chance of getting rid of it and achieving a cure. We want the word cure and cancer, the two chords, to actually go together, right? And this is kind of a paradigm shift that we haven't been able to do until recently. We began realizing that, you know, we should be able to do early interception of cancers. We can even do late interception of cancers to be able to get long-term remissions, which I would actually call cure. You're talking about somebody who's had cancer, very advanced. That's been completely eliminated by boosting the person's own immune system to wipe it out. It's like taking a cloth on a dry erase board and just erase the cancer completely. It's gone. 10 years later, it's still gone. I would call that a cure. All right. Now what I'm saying is that the small ones, we don't need to throw tons of imaging, tons of surgical biopsies, tons of equipment. No, you would never imagine treating chemotherapy for a tiny, small, early detected cancer. But I do think that you can remove something that's small. Why not? Okay. Then send it off to take a look at it to see how dangerous it is. I don't believe in burying the head in the sand. If you've got something you found that's abnormal, go for it. And yes, the individual might actually be scared and want to know what's going on. But that's why you need this sort of new crop, this new generation of physicians that are being trained through medical school that will be understanding that the body has this incredible defense systems to be able to heal itself, whether it's the immune system, whether it's hormonal system, whether it's the microbiome, whether it's the vascular system. These are things that, by the way, I was not taught in the same way when I went to medical school. But now the science is remaking the map, the roadmap of how the body can take care of itself. And I think that as we go into the future, even if we're diagnosing cancers earlier, we can now give people pragmatic advice. Even as medical professionals, surely we think the medical professional should master this, that will allow them to actually boost their own health defenses. Is eating a plant-based diet healthy? Yes. It's every single research study has shown that if you eat lots of plants, it's good for you. Are there nuances to that? Can you eat too many plants? What about the pesticides? What about GMO? Okay, we can dive down into those weeds, but in general, eating plant-based foods is healthy. Does that mean that eating meat is unhealthy categorically? Well, I don't like to get into those kinds of black and white categorical thinking. And this is where, the debate on food and health and diet starts to really become like an octagon where you're getting, people, where people are trying to get into the ring and fight each other to their death. Listen, I think the preponderance of evidence shows that eating some meat is okay, actually. So to the vegans, I respect moral-based, ethical-based eating. You chose not to eat an animal. That's fine. But honestly, the evidence also shows eating a little bit of meat is good. And by the way, meat is a great source of protein for obvious reasons, but also other micronutrients that you can't get that easily from plants. Creatine, and there's a carnosine, there's other kind of things. And so if you only try to take my religion versus your religion approach, you'll miss all the value that might come from something else. But anything in excess is probably not good for you. Now, what about saturated fat? It's interesting. Saturated fat, I know it's a big debate. Probably not good for you. And so probably it'd be wise to cut down. You don't need to cut it out, but cut it down. We're human. And when I when I counseled old patients and they are tensed up waiting for me to tell them no more cake, no more ice cream, no more candy, you got to eat the salad bar only. They're pleasantly surprised when I tell them, listen, the first thing I want to ask you is what gives you pleasure when it comes to food? What do you love? What smells came out of your mom's kitchen that always make you feel comfortable? What's that comfort food smell? That's how I should start with people, because I want to know more. What do you relate to? What rings your bells when it comes to food? Why don't we start there? Well, it's very hard to find foods that weren't exposed to some chemical, even in animals. I mean, if you were to be a carnivore, whatever you're eating what they ate, and so unless they came from a different planet, they were eating grain or even grass, that probably was exposed to some environmental thing. So it's really hard to be pure. I mean, I guess maybe that's what we're really getting at is there a way for us to take a common sense approach to diet and health that isn't trying to assign blame to an ingredient or a manner or a pattern of eating? And what about those people who do go gluten-free and all of a sudden they feel a lot better, or they go to carnivore, they go to vegan? I mean, you could even have an equal number of people who would say, I went vegan and I felt great on an individual level. Good for you, booyah, right? So I always tell people, if it worked for you, we don't really even need to understand why. We don't need to know everything that worked for you, and what worked for you might not work for me. All right? And this is why getting to know ourselves, like self-knowledge. Yeah. The martial artist Bruce Lee, right? So amazing guy that, so many years later, he died, in the 70s? 50 years later, plus, this guy is still being quoted. And one of the things he said is the ultimate knowledge is self-knowledge. And I do agree with that. If we spent more time thinking about what we resonate with and how we feel healthy and what makes us feel good and happy and content, I think that all the other data that we are able to get around us is going to be able to help us make better choices. And look, if you want to choose to eat one way versus the other way, that's okay. I just think that whatever you do, try to do it in a way that you can sustain for your whole life, right? I mean, it's very hard to maintain any extreme diet for any length of time. Usually they're short-lived. I'm a cancer researcher. I have spent my career helping to develop the newest, latest cancer treatments. I'm also involved with immuno-oncology, which is really not chemo and not even targeted therapy, but it's really giving medicines approaching cancer by boosting your own body's health defenses against cancer, specifically your immune system, and letting your immune system wipe out cancer. Remember at the beginning we were talking about, the microscopic cancers we're all forming. But that never become a problem because our immune system will spot them like cops on a beat to remove the drug dealers you see in the corner. That's basically how we normally don't get cancer more often. Here's the thing. When I see somebody who has been diagnosed with cancer, they always say, what type of cancer is it? How bad is it? What's the treatment? How long do I have? And then, why did I get cancer? And I would try to give them the best possible explanations on all of those for all of those questions. But I would walk away out of that room thinking, why an individual develops cancer is important to ask that to know the answer to. But an even deeper question, more profound question is, why don't we get cancer more often? Think about it. Like 1 out of 2 men and 1 out of 3 women are going to develop cancer throughout their life. That's the current today's statistics. But why isn't it 2 out of 3 women? And why did 100% men? Why do some people make it without getting clinical cancer? To me, that's a researcher's question. Let's figure that out. And the answer seems to be squarely, the bullseye seems to be that our body's hardwired with defenses against cancer, including our immune system. So immuno-oncology, immunotherapy is basically giving a treatment to a patient with cancer, regardless of where it's coming from, what organ started from, that boosts the body immune system. Okay, I'm giving you a simple explanation, but by boosting your immunity, now your own body cells, your own hardwire, your own operating system, think about a laptop, is actually able to be woken up to go after the disease that would otherwise be deadly potentially. Now, how do we know that works? Well, the immuno-oncology was a dream that was been going on, it's been going on for 100 years. People were thinking about this, but it's only within the last 10 to 20 years that it's become a reality. And now it's very real. Early days, but really real. You can give medicines to people with stage 3, stage 4 cancer. This is almost game over cancer, nothing else we can do for you. Now, there is something we can do for you. You can boost your own immune system. And some of these people's, not everyone, so we can't do it for everyone, but in my own career, I've seen what I thought would have been impossible. I've seen people go from stage 3, stage 4 cancer and wind the clock back and set themselves back to 0 stage cancer and been 0 stage cancer for a decade. Something I would have thought I would never see in my career is where the end of cancer is coming from. It's here now. We don't know how to deliver that to get that response for everybody yet. And that's very important to know. But if you have cancer, if you're listening to this, you're watching this, and your doctor is, not offering you immunotherapy, you need to have a conversation with your doctor, him or her, and to say, hey doc, for my cancer, is there any way of getting immunotherapy? Because I happen to know that's actually going to help my body fight off the cancer by myself. All right. And if the doctor says, well, not really, I don't know much about it, or I don't think it's going to work. Now, this is where access to information is going to be helpful to you. Type in your own cancer, type out immunotherapy, type clinical trial or approval, and hit return and search, and let the World Wide Web return to your fingertips. Okay? What is going on with immunotherapy for your cancer? And are there any clues that this might actually work? In which case, then it's time for you to advocate for yourself. And by the way, other things that we now know about immunotherapy is what you do at home between visits to the doctor's office or the infusion clinic can boost your own immune system. Immunotherapy is not like my doctor will handle it. No, when you go home, you can eat foods that can help to boost your immune system, including plant-based foods primarily. Okay. For immunotherapy, like for checkpoint inhibitors, you want to actually have elagitanins. These are polyphenols that are found in pomegranate and in dried cranberries and in Concord grapes. And they help your gut secrete mucus that grows a bacteria called Akkermansia, which you could also get as a supplement. But food is so much more than a supplement. Take the supplement, eat the foods that could actually grow it. It turns out studies that have been done out of Paris have shown in people who are on immunotherapy, if they have the Akkermansia bacteria in their gut, they're likely to respond positively to immunotherapy to have the immunotherm wipe out the cancer. You're missing that bacteria. You might not respond. That's not an option. That becomes now a life or death kind of stake, right? So this is where we're going for CA with cancer, like not just boosting our own defenses, but also looking at where the diet and the microbiome can actually intersect as well. There is value in measuring how we're doing because with technology, we can look at things like our biometrics, and this is the basis for the biohacking movement, which is, how do we measure how we're doing at any moment of time if we chose to. By the way, do you know the history of biohacking? Where did it begin, Dave Asprey? Or no, it actually began in the 1960s with the astronaut program. So the idea of biohacking, which is, a commonplace colloquialism, now actually began as a very serious enterprise where the NASA and other space agencies looking at the cosmonauts in Russia and astronauts in the US were trying to figure out how could we integrate technology into the suits and into the capsules that humans were going to blast off into space, and how would we know how well they're doing if you're driving in a car? You think about it. You're stepping on the gas. You're holding the wheel. You're going to wherever you're going to go. You're not thinking about it, but we're surrounded by instrumentation. And so the early history of biohacking dates back to the astronaut, sort of pioneering astronaut figuring out how to equip them for monitoring how their health was doing as they were going into space. So I thought that was important to know because this is not just a brand new thing that a few influencers, online kind of came up with. There's a real legacy behind sort of biometrics. And so biohacking, basically, I think there's real value in it. But if you obsess on your numbers, okay, and nobody's perfect, then you're not going to be happy with yourself. And then you're taking away from things. And I would say that the more obsessive we get on anything, and we live in a society, at least the Western society, but I think this is true everywhere, where there's a drive to be reductionist. If I can only use my V2 max and I can get my high sensitivity CRP and I can get my PSA down and blah, 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 you name the configuration of metrics, and this is like the basis of these big blood panels as well, okay? Or even full-on genomic genetic testing. How do you actually put yourself in the right frame of mind where there's nothing wrong, and actually there's a lot of good things about getting that information, but what are you going to do with that information? And how do you make knowing about that information healthier for you and less and not unhealthy? Hey, if you like that video, then you're going to love this one. Check it out.